So when do we say that you have recurrent bladder infections? We say that we have recurrent bladder infections if we get a bladder infection more than twice in 6 months or more than 3 times in a year. And it's not just based on symptoms. That means there must be a urine test showing the presence of pus cells and a urine culture confirming bacteria more than twice within 6 months or more than 3 times in a year. Peace be upon you. Recurrent bladder infections in women are among the issues that we see very frequently and that happen repeatedly, and unfortunately many people go through them without getting treatment. First, when we talk about urinary tract infections, we are talking about infections of the kidneys, bladder infections, and infections of the urethra. So what does it mean, first of all? What is cystitis? Cystitis means that bacteria start to settle on the lining of the bladder, begin to multiply, and cause symptoms. The symptoms of cystitis are usually a burning sensation during urination and a frequent urge to go to the bathroom. Because the bacteria present on the bladder wall cause irritation, and this irritation makes the bladder contract in small involuntary spasms. This makes me feel like I have a frequent urge to go to the bathroom, or that my bladder is full even though there isn't much urine in it. So the patient says, I feel like I want to. I go to the bathroom frequently, but when I do, there's hardly any urine, just a couple of drops, and they cause intense pain. There's an urgent need to go to the bathroom, and sometimes it's because of these contractions. These contractions can cause a sudden and urgent desire to go to the bathroom. There might be a couple of drops of blood at the end of urination along with the bladder contractions. The bladder squeezes itself to expel the urine that's inside, and at the end of urination, a drop or two of blood may come out. There may be an urgent need to go to the bathroom. This remains. Loss of bladder control means you feel a sudden urge, and before we reach the bathroom, a drop or two may leak out. Of course, urination is accompanied by pain in the lower abdomen where the bladder is, and there may be a burning sensation. All of these are the symptoms of bladder inflammation. Now, why do we say this? Recurrent bladder infections in women fall into a different category because it's been found that some women have a slightly weaker immune system in the urinary tract. And by the way, this can have a genetic cause. So they found that recurrent infections in women are placed in a separate category with their own specific treatment and a different approach to management. The first thing we need to know is, what does recurrent bladder infection mean? When do we say that you have recurrent bladder infections? We say that we have recurrent bladder infections if we get a bladder infection more than twice in 6 months or more than 3 times in a year. And it's not just about the symptoms. There must be a urine analysis showing pus cells and a urine culture confirming the presence of bacteria more than twice in 6 months or more than 3 times in a year. Right, first we want to know what causes these recurrent infections. The reason for these recurrent infections is something specific. Either we weren't able to completely eliminate the bacteria during the treatment period, meaning we gave an inappropriate antibiotic, or the antibiotic course was too short, so the bacteria weren't eradicated. So after a while, the bacteria caused the infection to come back again, or simply it's a reinfection where the patient gets repeated but different infections. I mean, not exactly. It's not that the same infection happened again from the same bacteria. No, it's a different bacteria, but a reinfection occurred once again. So what tests do we use? How do we deal with this? Now we've diagnosed that we have recurrent bladder infections. So how do we manage them? The first and most important thing is to deal with the acute infection that's present right now. Meaning if we have symptoms of an infection, a bladder infection right now, we have to treat it well and make absolutely sure that we've eliminated the bacteria. How? By doing a urine analysis, a urine culture, and then giving an antibiotic. And we wait for the culture results, and then we modify our antibiotic according to the culture results. So if we find that our antibiotic is suitable for the bacteria and can eliminate it, then we just continue with the same antibiotic for the full recommended duration, of course. If we find that the bacteria are resistant to the antibiotic we gave, then we change the antibiotic based on the culture result. So now we've made sure that we've treated the current infection. What should we do to reduce the recurrence of bladder infections? There are many things we can do. The first thing is that we can use natural remedies. These remedies reduce the incidence of bladder infections. Like what? Like cranberries, for example, which contain a certain substance. This substance prevents bacteria from sticking to the bladder wall. And actually, that's the most important mechanism for bacteria to resist any antibiotic. They keep clinging to the wall and don't let go. So they found that cranberries contain a certain substance. This substance prevents bacteria from sticking to the bladder wall. So the first thing we can do is we can take cranberry juice, or now there are tablets and effervescent powders that contain it. We take the active ingredient found in cranberries daily on a regular basis. All right, the next thing is sometimes we give something called, what does that mean? That means I give an antibiotic in a very small dose, regularly taken continuously, and we call this a preventive dose. So this is not a therapeutic dose. We take this antibiotic And of course, it's not just any antibiotic, it's a specific type that is excreted through the urine. So the concentration of the antibiotic becomes very high inside the urine, and this increases the immunity of the urinary system. So how long do we take it for? We might take it for 6 months, or we might take it for a year. An antibiotic in a small dose, once a day, to boost the immunity of the urinary system. Alright? Some women experience these recurrent infections. After menopause, why? Because after menopause, there are some hormonal disturbances and the estrogen hormone decreases. This hormone is very important for the growth of beneficial bacteria called lactobacilli, which are present inside the vagina. So when estrogen decreases, the lactobacilli, they become absent. And this affects the pH level of the vagina and the whole area, which helps the harmful bacteria to grow. But usually we give local estrogen in the form of topical treatments to increase the lactobacilli, which are the beneficial bacteria in this area, and thus reduce the growth of harmful bacteria there. Also, another thing is that some women experience recurrent infections. This is very much related to intercourse. So they found that if we take a dose of antibiotics within 2 hours before or after intercourse, it greatly reduces the risk of developing postcoital cystitis. And we don't give this to all women. We only give it to women who suffer from recurrent bladder infections related to intercourse. We take 1 antibiotic tablet 2 hours before or after intercourse. These are all the things we can do for women who have recurrent bladder infections. I really hope you found this video helpful. And if you found the video helpful, please like and subscribe to our channel so you can get the rest of our videos. Wishing you 1,000 good wishes. See you in the next video, God willing. Peace be upon you.